What's up, everybody? Dr. Rossi, shrinksandSneakers.com. I've been getting a lot of questions recently about lifestyle medicine and lifestyle medicine applications to psychiatry specifically. Now, I think I want to start with a brief video just kind of explaining why people don't use lifestyle modification in psychiatry before we go on to the ways I use lifestyle medicine to help treat patients with any type of psychiatric disorder, really, but I'll explain some of those nuanced points in a further video. So I want to say first that it's not unique to psychiatry, right? People may think like, well, psychiatry might be the least likely to use lifestyle medicine and lifestyle modification, but if you think about any other practice of medicine, where do you really see people using lifestyle interventions to treat any type of medical condition? I mean, even things that are modifiable by lifestyle intervention, such as type 2 diabetes, hypertension, hyperlipidemia, you often do not see, primary care doctors giving a thorough understanding or a thorough plan for how one might implement lifestyle modification to change or alter the course of those diseases. So this is not unique to psychiatry. You see it all over medicine, and a lot of that has to do with the fact that you cannot get paid for healthy diets and exercise plans and all that kind of stuff, right? Insurance doesn't bill for those kind of things. It will bill for prescriptions for medications. It will bill for procedures and surgeries, etc., etc. So there's an issue right there where fundamentally we're not incentivized to treat our patients with lifestyle modification because there's no financial benefit. And if you work for, a hospital system, or even if you're working, as a private practice doc, you still need to worry about, making some type of income. And of course, the systems are going to be very worried about you turning some type of a profit. And that's their goal. They're hiring you to, make money for the system. So you have to do those things, unfortunately. And I don't want to sound too cynical about it. At the same time, I do think there's obviously benefits to medication. There's obviously benefits to procedures and surgeries in many cases. But again, no incentive to do lifestyle modification. The other aspect of it is most physicians don't know anything about it. Plain and simple, a lot of physicians don't practice lifestyle interventions in their own life, so they have no reference experience to help teach patients how to exercise, how to start a good diet, how to make good food choices at the food store. You have no idea, simply no idea. And the medical training doesn't cover it. I mean, to be honest with you, in my medical training, I had like maybe a few lectures in biochemistry, maybe a few lectures towards my fourth year that focused specifically on nutrition, and that was it. And I certainly didn't have anything focusing on exercise or mindfulness practices, or sleep outside of the sleep disorders. With that said, you can see why, again, people don't know anything about it. People are not incentivized to do it, yet it has a lot of good evidence. And even if it doesn't completely cure a psychiatric condition, which again, I sort of don't believe those things either. A lot of times, people will say, well, like all you need is herbal supplements and the right diet and the right exercise routine and, your depression goes away. Well, maybe not. It depends on how severe your depression is, and it depends on many factors. So it's not quite that simple. But, if you are working with a patient who's depressed, it makes sense to me that you would at least use lifestyle interventions as one of the tools to help treat the depression. So, again, it's a little bit of a nuanced point, but still, there's a lot of value in lifestyle medicine. So basically, people are not incentivized, they're not trained in it, and they simply don't know anything about it. So it's hard for those people to do that. Now, specific to psychiatry, the last point I want to make here is just that specific to psychiatry, if you're dealing with severe mental illness and people who are very unstable, people who are very decompensated with severe disorders like schizophrenia, bipolar 1 disorder, you may find it very difficult to implement lifestyle modification at the beginning of the treatment. And that's because they need to be stabilized first, and along with things like schizophrenia come things like housing issues, money and financial issues. So telling somebody to go out and buy certain types of foods, telling somebody that they need to start an exercise routine is going to really fall short of the main issues that that person's facing at the given time. So it can be really difficult in, say, an inpatient setting or emergency setting to make any changes there. But in an outpatient setting where somebody's already relatively stable, they might have been on medication for a while at this point, and they want to start thinking about either lowering the dose of medication or getting off of medication, but they want options to help continue to treat their depression. Or let's say, for example, that is a situation where obviously lifestyle medicine could make a huge impact. So those are the things just off the top of my head that I could think of as to why psychiatrists and why other physicians are not using as much lifestyle modification as they should be. But I can tell you certainly in my practice and in my future, I plan on using a ton of nutritional psychiatry